Hi, it's Miranda from Learn Emergency Response, and I'm here to teach you how to respond to a medical emergency. If you've been following along, you know what this is all about. If you're new here, welcome, hi. I'm a paramedic, CPR, first aid instructor, and we were talking about a few weeks ago what to do when someone's choking and what to do, how to tell if they're responsive and making sure the scene is safe. If you haven't watched those, go back, check them out at Learn Emergency Response on social. But before we jump into talking about how to check for breathing and pulse rate, we're going to talk by special request. I've had several people ask, they want to know about seizures, what to do when someone is having a seizure in front of you. What is a seizure? A seizure is simply a name for abnormal electric activity in the brain. And there can be a lot of different causes for this. We'll go over those. But what you need to know is that most seizures only last about 30 seconds to 1 to 2 minutes. Pretty short. Epilepsy is a name for a disorder that is a medical condition when someone has been diagnosed with having recurring seizures. So if someone is epileptic, typically they've had more than one seizure before, they've been seen by a healthcare provider, they may or may not be prescribed medication for it. Let's talk about some causes of seizures. There can be a lot of different causes of seizures. It can be something like a head injury or trauma, where you've got a brain or skull injury. It can be low blood sugar. If you know anyone who's diabetic and they get hypoglycemia, which just means your blood sugar gets really low. Sometimes you can tell they get really pale, really sweaty. They start not making sense. Maybe they're a little bit altered. This can lead to seizures if their blood sugar is too low. Also things like electrolyte imbalances, ingestion, poisoning, or overdose, whether someone intentionally took something they shouldn't have eaten, or they've taken drugs, or maybe they accidentally, got into something and ate it and it's causing them to have seizures. Also things like heat injury. If you get too hot or overheated, you can start to have seizures. Fevers in pediatric patients or kids usually under the age of 6, they have what they call febrile seizures. And this looks really bad and scary. If you've never seen a seizure, it's pretty scary to watch. Febrile seizures are really common, especially if they have a fever that's, above 101, 102. These little kids, they get hot really fast and they just have a seizure. Definitely want to treat the fever. Want to make sure we're alternating Motrin and Tylenol according to the dosage on the bottle. It's going to go by their weight. But it never hurts to get them checked out if you see a kid have a febrile seizure. And definitely if you have a child that's small and they keep having seizures, you definitely want to follow up and get some health care for them. Also, things like cardiac arrest. It can start out with someone having a seizure and then they go into cardiac arrest. So these are going to be some common causes for seizures. Okay, this is going to be a 3-parter because seizures are a lot. So we just talked about what's a seizure, what are some causes of seizures, and in the next part, we're going to talk about some signs and symptoms of seizures. And then for part 3, we're going to discuss what you do during a seizure, so the first aid and care for people after a seizure. Hope this is helpful. Bye. Hi, it's Miranda from Learn Emergency Response, and this is part 2 of seizures. So in part 2, we're going to talk about some signs and symptoms of seizures, what to look for. Let's talk about some of the symptoms of seizures. So the first symptom that someone may experience if they have epilepsy or a known seizure disorder is called an aura. And an aura is a feeling that someone who has seizures gets before the seizure happens. A lot of the times they can tell you, I feel like I'm about to have a seizure. So if you know someone with a seizure disorder and they say, I think I'm about to have a seizure, I feel like I'm about to have a seizure, you're gonna wanna make sure you move them to a safe space. And that can either be a bed or a couch, as long as there's not the potential for them to roll off onto the floor and harm themselves. Or if you clear out an area of the floor, clear it from obstructions, maybe put a pillow down, they can put their head on so they're not going to hit themselves on anything. That's a fine place too. If someone tells you they're about to feel like they have a seizure, they have that aura, just get them on the floor, make sure there's nothing for them to hit themselves or hurt themselves on during the seizure, and put a pillow under that head before it starts. The first thing that happens after the aura, if someone has one, not everyone has auras that has seizures, by the way. The next thing you're gonna notice though is a loss of muscle control. And this can happen in a bunch of different ways. There are actually 3 different types of seizures. So you have what they call an absent seizure. And what happens with an absent seizure is maybe someone just freezes up fully. They're not moving at all. hello, it looks like they're not there, they're staring right through you. That's kind of characteristic of an absent seizure. The next seizure that they have is a tonic-clonic seizure. And this is the characteristic seizure that you see in TV and on the movies. And what's going to characterize the symptoms of a tonic-clonic seizure is going to be muscle contraction. So they tense up and then they go into the full shake. And that's a tonic-clonic seizure. Typically during these seizures, there will be unconsciousness either before, during, and after. And then the third type of seizure that you have is a partial seizure. So during a partial seizure, it's usually isolated to one area of the brain and it causes movement or jerking only in one body part. Sometimes it's just the arm or just the leg, and that's known as a partial seizure. Sometimes during partial seizures, people can still have consciousness, but they know that they're having that partial seizure. Also, very classic seizure symptoms, you're gonna have loss of muscle control, characterized by shaking and jerking or a lack of movement. Also incontinence. So sometimes during a seizure, people will lose control of their bladder, lose control of their bowels, they poop, they pee. Hey, this is a medical emergency. It happens. Totally normal symptoms during a seizure. And then after they are done having a seizure, you have a period that is known as postictal. So someone has a postictal period. This is a period where they are altered mental status. Sometimes they're really confused. Sometimes they're very lethargic or sleepy. And there will be a period of unconsciousness. They should come out of that unconsciousness fairly soon after the seizure. If someone has a seizure and they are not coming out of that state of unconsciousness, you need to go ahead and call 911 because something's wrong. You know, they should be waking up in some way. They might not be fully with it. Also, sometimes people get combative. Maybe it's someone you know and what, they're trying to fight me, like we're best friends, I don't know what's going on. That's just because they're confused. They're in this postictal state. And that's normal for post-seizure things, okay? But either way, if they're not coming out of it, you need to go ahead and call 911. So that's it for part 2, signs and symptoms of seizures. In part 3, we're going to talk about what to do when someone's having a seizure, that first aid, and then post-seizure care. Hope this is helpful. Bye. We are on to part 3 of seizures, and in this last seizure video we're going to talk about what to do during a seizure when someone's having a seizure, and then post-seizure care, what to do until help arrives. So without further ado, let's check on Manny and see what's going on because he's having a seizure. All right, so we're gonna visit our friend Manny. Poor Manny, he's having a Monday. He's having a seizure. So Manny's fallen down by his desk, he's shaking. Oh no, and he's banging his head against the desk. So what we don't want to do during this is we don't want to try to hold a person that's shaking still. That could actually cause further harm. So what you're going to want to do is you're going to want to try to protect them from injury. So if Manny's shaking, we can take a pillow, we can pat it here on the side. Boom, now Manny's hitting the pillow. If you're able to, you can try and get a pillow under Manny's head while he's shaking. Manny's still shaking with his seizure, but you just want to make sure you're not blocking his airway or anything. But if you could get an object between their head and a hard surface, great. If you could get it under their head, great. And again, as you can see, we've patted her on the head. This is a big, heavy desk. We weren't able to move it out of the way. But if they fall and there are objects or obstructions in the way around them that you can move, you can go ahead and move those things out of the way, kind of clear the way, pat his head, and then you want to make sure you're never ever holding anyone that's having a seizure down and never ever place anything in their mouth. So post-seizure, if needed, you can also place someone in what we call a recovery position. So say if they have a lot of airway secretions, if they have foam coming from the mouth, that they're vomiting, you can go ahead and turn them on their side, like so. Just on their side, up on their side. Make sure that their mouth and nose are clear. Make sure they're not, we don't ever want to put them, this is called prone, when you put them face down, never face down. But if you want to, you can place them on their side in a recovery position until help arrives. So some other first aid reminders here is they might, biting their tongue is pretty common during a seizure. Never ever try to put something in their mouth or stop them from biting their tongue. Sometimes they hit their head, they get little cuts or abrasions. If they're bleeding from anywhere because they've injured themselves during a seizure, wait until they stop shaking before you administer first aid to any kind of cuts or scrapes or anything like that. But after they stop shaking, you're welcome to, bandage up where they're bleeding from to help stop that bleeding and control it. And when to call 911. So if someone has a known seizure disorder like epilepsy, they take medication for it. If they come to pretty quickly and this is something that happens to them, you might want to discuss with them, did you take your medicine today? Is everything okay? Do you want me to call 911 for you? If the person has never had a seizure before, call 911. It's abnormal. Even if it's a febrile seizure and it's a kid, it never hurts to get checked out because there could be something else going on. Definitely want to call 911 if the person has difficulty waking up, obviously if they have difficulty breathing, and if they have more than one seizure. So if they have multiple seizures, one after the other, by all means, you're going to want to call 911. And again, seizures should only last 30 seconds to 2 minutes. If this person is having a seizure for more than 5 minutes, go ahead and call 911. Also, if they experience any injuries, like we just talked about, bleeding from the head or face, definitely if they have a seizure when they're in water because they could swallow water and they can, get water in their lungs or aspirate. And if they have a known medical condition like diabetes, go ahead and call 911. If they're pregnant, definitely go ahead and call 911. And then of course, if they're gasping, they're breathing abnormally, or they go into cardiac arrest, we're definitely going to want to call 911 here. And last but not least, when you have your seizure patient in the recovery position, you want to stay with them until help arrives. So until they start acting normal again, if you called 911, you're going to go ahead and stay with them, keep an eye on them, because again, there is a chance that if they have one seizure, they could have another. And you want to be there. You want to make sure they're still breathing. You want to make sure that you have them on their side in the recovery position if they need it. And you're just going to want to wait and stay in case they need your help again and before the ambulance gets there. That's all I have to tell you today about seizures. I hope this was helpful. And we are going to talk about pulse and breathing here coming up, so stay tuned for that. And let me know if there are any other medical emergencies you want to learn about. I hope this was helpful. Bye.